I'd like to welcome you to the April meeting of the second Wednesday Gainesville End-of-Life Doulas. These meetings are on Zoom, and they're always on the second Wednesday at 3 o'clock. We've been doing them since September of 2023, and these meetings are co-sponsored by Eldercare of Alachua County and the Senior Recreation Center in Gainesville, Florida. Today's April 9th, 2025, and we are glad to be here. This meeting is Dementia Resources in the Gainesville area. We wanted to have a collection of a panel of people who are involved in this area so that our caregivers and our people could know what's available in our area. So I also want to share that I'm the president of the Florida End-of-Life Doula Alliance, which is a 501c3 nonprofit. We got our nonprofit status last year in June. And we, as far as we know, we're the first statewide organization of its kind. We do have a doula directory, and we have other educational videos that we've put up on our website. And that is feolda.org for anyone who's interested. The Gainesville group, it has a YouTube channel, which is where you will find this video as soon as we get it up there, and that is Gainesville EOL Doulas, and that's our YouTube. So anyway, as I say, the title of today's program is Dementia Resources in the Gainesville area. This is the second in a three-part series. On March 12th, I shared the story of my mother and our journey with her through her dementia. And then next month, on May 14th, I believe it is, we will have Chris Larson, who wrote a book called Rosemary Now and Then. And her book is about her journey with her mother through dementia. So she will be speaking at our next meeting in May. So today we have a panel of 4 different organizations that are active here in Gainesville. We have the Alzheimer's Association, and that is Skylar Davis. We have Johnny Jones, who works with Elder Options in the Savvy Caregiver program. And Meg Handley is the sales rep at the Windsor of Gainesville. And Aja Cannon, who is the care person at Alz Place. I'll let her introduce herself as to what she does. So the exciting thing for me is that I have personally been involved in every one of these organizations. We also have Timothy Hannon with us, who is with Eldercare of Alachua County, and he's the manager of the program operations. And we'll give him a little time to share just a bit. And I have been benefited from all of these organizations. So what we're going to do is we're going to start with Skylar Davis. And please, Skylar, tell us a bit about the Alzheimer's Association and the annual walk. Is it once a year that you do that?
Yes. So my name is Skylar Davis, and I am the walk manager for the Walk to End Alzheimer's in Gainesville. But I want to start by talking a little bit about the Alzheimer's Association as a whole and what we do. We've got 3 main pillars: our research, our advocacy, and our care and support. Our research is huge. We invest over $430 million in research across 57 countries. Wherever the researchers are, that's where we want to be involved. We do a lot locally with UF Health in Gainesville, and Mayo Clinic in Jacksonville, all across the state of Florida, the US, and the world. We're looking at things like controllable risk factors, things about slowing the growth of plaques on the brain. We've got some really exciting treatments coming out. We're kind of titling this time as the era of treatment. So really, really exciting things coming from our research. The second thing we do is advocacy. So we send advocates to every level of government, from our local state to Washington, D.C., and get to talk to lawmakers that are actually in control of the things that need to be changed. I had the opportunity to go a couple years ago and be a fly on the wall, and to be able to sit and watch people that I know personally tell a Florida senator their story and why certain bills are important to them was super, super incredible. We've gotten extended funding for our brain bus, which is something that's exclusive to Florida. It's a bus that is able to drive around and provide resources and preliminary diagnoses to people in communities all across Florida. So we've gotten grant funding for that. We've gotten extended training for law enforcement on how to deal with people with Alzheimer's and dementia. As you can imagine, that's a huge problem. As we were just talking about before we started recording, how people with Alzheimer's or dementia can escape, be places they're not supposed to be. And a lot of times law enforcement is brought in to deal with that. And so being able to train them is super, super helpful. And then our programs department, we're the local boots on the ground doing support groups, running our 24/7 helpline. The number for that is 800-272-3900. So if you need anything, any day, anytime, I have experienced people that call at 2 a.m. when mom is throwing dishes and doesn't know who her daughter is and thinks that she's broken into her house. They call the helpline. They are trained clinicians and specialists that know what they're talking about. They're equipped to handle these situations. And so they can help de-escalate and then create a plan to move forward. And like I said, our support groups, alz.org is huge. If you need any resources, you can find all of the things I'm talking about there. We have Alz Connect, which is a kind of a online discussion group where providers and patients and caregivers can get together, ask questions, share their experiences. And so that kind of leads me to the walk, which is our largest fundraising event. It's kind of what we use to fund all those resources I just talked about. It's kind of a giant support group. It happens this year on October 11th. It'll be at Trinity United Methodist Church. We start checking people in around 9 a.m. It's only a mile long, so bring your friends, family, babies, pets, grandparents, anybody. I went to the Orlando Walk a couple of years ago, and a lady brought her ferret, and it was on a leash, so I don't care. But it's a super, super cool event. We get together. We have all of the different colored promise garden flowers that represent different connections to the disease. Some people raise money. People get t-shirts. It's a really, really cool event. And it's so special to be able to see so many different people going through the same thing that you're going through. I hold an orange flower. And when everybody in the group raises up their orange flower, I get to see all those people that are supporting this incredible cause. And so we couldn't do the things like the research, the advocacy, the programs and support groups that we do without the Walk to End Alzheimer's. So I would encourage anybody that is interested in participating, reach out to me. And like I said, alz.org, if you remember nothing else, that's where you can go for all of the resources that we provide. So thank you so much for having me on. And I hope to see you all on October 11th.
And that starts at 9 a.m.?
9 a.m. Yep.
Okay. So, and you can go to the website to sign up and get
alz.org/Gainesville is where you'll find the walk information.
Okay, great. Is there anyone has any questions for Skylar about the Alzheimer's Association?
I have a quick question, Skylar.
Yeah, go ahead.
How do you schedule the brain bus for an appearance?
Yes. So if you shoot me an email, it's sjdavis@alz.org. I can connect you with our local programs person. Her name is Donna Lee Brunson, and she is the one that's in charge of scheduling that. And we would love to get the brain bus out to you for your employees, your patients, your community. Would love to connect you with that. It's a really cool. We had it out at one of the blood donor locations yesterday, actually. So.
Anybody else? Great. Well, thank you so much. That's just lovely.
Thank you so much.
Thanks, Skylar. We'll see you soon. And I know Skylar has to leave because she has another meeting to go to, so I appreciate that. Let's go to Johnny. Share with us about the Savvy Caregiver. Let me first say that I took the Savvy Caregiver training twice. It was so good, and I needed to do it again. And it helped me immensely with caring for my mom.
Thank you, Shanti. I really appreciate that plug. The Savvy Caregiver Program is a part of a wide suite of programs that we offer. My name is Johnny Jones. I am the coordinator of caregiver training and support at Elder Options. Savvy Caregiver is one piece, one part of the larger suite of programs that we offer to support caregivers, primarily of those caring with living with dementia. And the reason why we have chosen to focus on that is because dementia caregiving is very unique. It requires more time, more effort, more energy, typically than any other type of caregiving. So we focus our efforts and energy on using evidence-based programs in my narrow piece of Elder Options to help with that. I did place some information in the chat earlier, and that is my information, my direct contact information, as well as the agency's information, including our elder helpline. Elder Option is way, way more than me and who I am. Again, we cover 16 counties. And so with all of that, there's a lot of work to be done, but also know that anything regarding aging, the aging population, aging in place, the disabled population, probably a first stop for anyone that inquires of you would be the Elder Helpline, which I put in the chat. So please do use that resource if you need, or if you just have questions, or you can, again, email me directly and I'll be happy to point you in the right direction if I'm not that person. So Shanti mentioned Savvy Caregiver Training. It is one of the evidence-based programs that we offer. We used to sort of, all of our branding was Savvy Caregiver, but we don't own that. So we use that now just to mention, to add it into one of the many evidence programs that we offer. We offer Coping with Caregiving, which is another evidence-based program. We have offered T-Care, which is a one-on-one evidence-based program. I am a certified dementia practitioner, a certified Alzheimer's disease and dementia care trainer, and a certified dementia support group facilitator and trainer. So that's the sort of the expertise, and many of my team members are also certified dementia practitioners. And we do a lot of training, not just for our caregivers in the area, but also for people who desire to work and offer caregivers from a professional standpoint advice and support. So with that being said, I would encourage you to look up our website, agingresources.org, find caregiver training and support, and you will see all of the services that we offer, including support groups. We have about 5 or 6 support groups. Some of those are in person. Some of those are done virtually. We are even adding a telephonic grief support group because we found that, sometimes even this can be a little uncomfortable for people, especially discussing grief. So we're going to do that grief support group by phone. So that's a new addition to the type of things that we're doing to try to be innovative and to reach innovative by going to a conference call, right? But we're doing as much as we can to reach as many as we can. In addition to the programs that I mentioned, we will always be willing to show up in any of your organizations or for anyone to present specifically on what we're doing. I do want to mention that I'm the co-chair of the Dementia Care and Cure Initiative Task Force. I co-chair that with Jessica Kerwin from the University of Florida's Memory Disorder Clinic. There are, I think now, 12, 13 memory disorder clinics throughout the state. And it's very important to participate in that work as well if you want to know everything that's going on. Our goal as a part of that task force is to make our immediate area more livable and more dementia friendly. So people who are actually experiencing it or giving care for people with dementia, we're here to provide that support and sort of help build the framework for that community and to move us in a better direction. So with that being said, that is probably the fastest run through of Elder Options I've ever done, but please reach out. So many services. Of course, the SHINE program is through Elder Options. Healthy aging programs are through Elder Options. We have a veterans directed support program through Elder Options. So many services, and we're just one tiny little piece of that, but we can help you.
Wow. And such a great need being filled there. So Uh, I remember, I don't remember if it was in one of your trainings or not, but somebody suggested to have a little card that you pull out of your pocket and put it on the counter if you're in a store that says, please understand, or please be patient. My person has dementia or has trouble understanding, or, just to give people a little visual cue, because it can be awkward and people can be in a hurry and be impatient. I mean, so many cool little tricks
Yeah.
and things. So does anyone else have any comments or questions for Johnny while we've got him here? Yeah, I think it's really awesome what you're doing, and it's so nice to get to meet you.
Great. Thank you so much.
Thank you, Johnny. Hey, Chris. Welcome. Yeah, so what we're doing is we're doing some quick well, you're doing great with the elevator speech. Just quick little rundown on what these different organizations do, and what they have to offer in our community. We had Alzheimer's Association, and we had the Elder Options, and now we're going to have Meg Handley, who is a sales representative at the Windsor of Gainesville. And she's going to talk a little bit about the Windsor. You are muted, Meg, so we'll get you to unmute there. I have a personal connection with the Windsor because my father-in-law was there for a number of months in 2022. And they were just lovely to allow him to just accommodate him with his dementia and his special needs. And he was a special person. Actually, Aja's smiling because she worked there when he was there, so we can chat a little more about that later. But also, I will say that the Windsor is one place that if someone is already on hospice and wants a beautiful, peaceful, cared for place to be, they accept you if you're a hospice patient. And I took a tour with someone who actually was in that position. And so, Meg Handley, take it away.
Thank you. So the Windsor of Gainesville is part of a corporation called Legend Senior Living, and it was created almost 30 years ago by Tim Buchanan, who saw a gap in the industry. And that gap was a place to go home to that didn't look like a hospital bed with seafoam green walls surrounding you. He wanted a very different environment for his residents. And so the Windsor was created. And our goal, our mission is to provide the highest standards and quality of service for our residents, and provide that environment where they're safe and they have their dignity, and hopefully they can have some fun and enjoy this time in their life. And one of the things that is so important are the connections to the community that we have. It's not just about getting residents in the building and filling up bed space. To do that, we have to create relationships in the community. And I've met, and even through this, I've met so many people in this community and through different networking groups that are, working to help these people that have dementia and Alzheimer's. And we have several ways to do that at the Windsor. We're an assisted living community, and we also have memory care. We have different reasons for people being placed in either assisted living or memory care. And what we want to do is make sure that each resident has a customized level of care to meet their particular needs. So, because we know that our resident on the first floor might not have the same needs as someone on the second floor. And it's fascinating because you even see people that vary greatly in their symptoms and how they present dementia and Alzheimer's. And as far as the connections to the community, what we want to do when a family comes in is make sure that they have all of the answers they need so they can make a decision. It's not just about selling, it's about guiding someone to the right place and the right decision. And that starts with sometimes difficult, conversations with the families. And in order to do that, we do enlist a lot of resources such as elder options, elder care, the VA, and assistance, anything we can do, and sometimes other communities. Sometimes our community may not be the answer, and we work with other communities if we see a need that we can't meet. We have a lot of really wonderful programs in our memory care that our staff works very hard on. Our care staff is great in memory care. And one of the wonderful things that I love about it is they use a best friends approach. And we do that by gathering a lot of history on the resident. We're very nosy. We want to know who they were before Alzheimer's became the biggest part of their life, because before that happened, they were, a mom, they were active in their church, they had amazing careers and traveled. And so that's what we want to know about, because that helps us help them. It helps us approach them. We know how to treat them better, and it helps us help the families. And the other thing we do back there in memory care is called parallel programming. And we want to have them in activities that are designed to meet where they are at with their cognitive level. Not everyone is the same in memory care. Everyone presents a little bit differently, and our residents can handle different activities. So while everyone is participating at the same time, there's different levels of activities that are going on around them. And then we also have like a horticulture therapy. They have a raised garden out in the beautiful sunny off of the sunroom. We have a courtyard, and we have a raised bed, and they like to work with herbs back there, and they love to be outside. And then we also have a paraseal in our memory care, and it's actually a very high tech it's a seal. It looks like a stuffed animal, and it actually is designed to react to different stimulus in the environment. And it also, over time, will react to a particular resident in a certain way. And it's a seal because using a cat or dog can, sometimes trigger an emotional memory that we don't want to do, sometimes good, sometimes bad. So we have some really interesting therapies and activities at the Windsor. And in addition to that, we have a lot of events here, as some of you, as I'm sure you remember. And Shandi, you've been to some of them too. And we have a lot of events that we want the community to come in and enjoy them, so they can see what's going to be happening for their loved ones when they come into the Windsor. And so we invite the community, we invite professionals, and of course, our residents to these different events. We have a Springtime in Paris event coming up. A lot of them are celebratory. We had a lot of events over Christmas. And we do that so people can see what we're about, that it's a beautiful home-like environment, and we're having a lot of fun. And, in creative ways. We have an awesome activities director that is one of the, the activities programs here are really probably the backbone of the Windsor.
Yeah, I've gone in sometime when they had a beautiful singer in the lobby, and it's elegant, but it's not over the top. Like, it's very elegant, and they have a movie theater. And I actually, I mentioned earlier, I don't know if you remember, but I mentioned that I'm in the improv group at the senior center, and we performed at the Windsor. And actually it was when Peter was there, but he wasn't able to come, but it was my husband's birthday, and we sang happy birthday to him. But we performed in the movie theater, and it's just very chic, very fun. And is there anyone who has any questions for Meg about the Windsor? I will say that
I want to go.
Oh, well, when you come to Gainesville, come on. Yeah. What was I going to say?
Not by any time.
Yeah, they have a lovely, lovely program. They have an arts and crafts room, and just lots of good stuff there. Well, if there aren't any questions, Aja used to work there. So I'm going to offer, if you have anything to add to what Meg said about the Windsor.
I agree. So yes, I was the healthcare director there for almost 4 years at the Windsor. It's a beautiful facility inside and out. What she said, Tim Buchanan, he's been in senior living for a long time, and he calls everything purposeful. So like the paint colors, the lighting, everything that is used was made for a purpose. The types of carpet, so that people, when they start experiencing issues with depth perception, that they don't think they're falling. So all of those sorts of things are very, very important. Sorry, my phone's ringing now. I'm just gonna turn it down.
Thank
So all of that
you.
is very important, and the activities are great. You know, the residents are great. It's a great place. And Allison too. Tell her I said hello.
The
I think
activities
she heard you.
coordinator.
Okay. So
Lovely. What a community we have. Isn't this, look
yeah,
at
yeah.
all what we have. It's amazing. Well, and that segues into Asha sharing with us about
Yes.
Alz Place. And again, I had my mom there for I guess 2 or 3 years. She died in April of 18, but it's a delightful day program. Oh, I did want to mention that we also have Altrusa House in Gainesville, and that we had our person there because he's a veteran, and I believe vets can go, their cost is covered. So I did want to just give that mention. But Al's Place was really, really fun, and they have all kinds of music and dance, and they have improv now. They have improv on Monday mornings
Yes, we do.
with
Where this is
Carolisa.
Bergen.
So,
Mhm.
all right, so take it away, Asha.
Okay, so my
Tell
name's
us.
Aja. I'm Aja Cannon, and I've been here almost 2 years at Al's Place, and we are considered an adult day program. I don't like to say adult daycare, but we are an adult day program, and we provide in-facility respite to clients in the area who have Alzheimer's or dementia. So, I always say it's kind of a two-part. It is the clients get to come here and participate and engage in all of the activities and music and things that we do. But it's just as important for the caregivers, if not more, because we have with our clientele, we have spouses that are taking care of their loved ones and sometimes who are in their 70s or 80s and trying to, shower and bathe and do all of the ADLs. But then we have children of clients who are still working full time and they are taking on with having young children, and then maybe they have a spouse and then trying to take care of their dad or their mother, and it's very challenging. So the program is for both. So we are open Monday through Friday from 7:45 until 4 p.m. It is a grant funded program through the Alzheimer's Disease Initiative, so clients can attend, and their copay is based on income, and that income is either for a client themselves if they're single, or it is for a spouse if married. And the maximum, so there's a sliding scale for that, and the maximum that anyone would pay is 3% of their income. Some of our clients, if they do have a lower income, it could be at no cost, $20 or $30, but just depending on that sliding scale. So the first process, we get phone calls all the time, say, what do I do? I want to come to Al's Place. I just want some information about Al's Place. So the client does need to be um, a resident of Alachua County, have a primary or secondary diagnosis of Alzheimer's or some form of dementia, and then have a primary caregiver. So that is someone who is a non-paid caregiver who is in the home with them, taking care of them on the day-to-day basis for their IADLs, whether they're shopping, managing finances, or assisting them with their ADLs, bathing, and sorts of things like that. If there are exceptions that we've had before, if someone does not live in Alachua County, that we could go through Elder Options to get approval. So for example, if someone is in Marion County, but there isn't a program that is available in that area, that we could be able to get approval. And that's done on a case-by-case situation. We would just get that information to Elder Options. give them the client's information and they will give us the yes or no. And that sometimes is dependent on funding if someone is in another county. So my job here is the clinical case manager, is I'm walking people through the steps of that process. So either sending that email to Elder Options with the client's contact name, their date of birth, and the caregiver's name, and saying this is a new Alz Place referral, and so that they can have a phone screen done. Elder Options is going to complete something that's called a 701S, which is a phone screening, and that will happen and gather some basic information about the client and caregiver. Once that happens, then there is an in-home assessment that is scheduled, and that will go further in depth with questions about the client's total ADLs, what they can do, past medical history, the strain that it is on the client, on the caregiver. Does the caregiver have any additional support in the community? And that just kind of ranks them in order, not just for us, but for other programs if they're seeking. Sometimes when people are going through the process, they may be looking at placement and things of that nature as well. So they get a ranking score on that. But our clients will come here. Like I said, we're open Monday through Friday from 8 to 4, but clients don't always acclimate the same way. What's good for me may not be good for you. And I may be coming from home and I'm just at home with my spouse all day. And so when I come and now I have a sensory overload, that may be a lot for me. So we start our clients out with 2 days a week at 4-hour intervals at a time, so that they're able to acclimate and adjust. And that gives us time to figure out what they like, what they don't like. Kind of at the end of that, we do a 14-day follow-up, but at the end of that 2 weeks, I touch base with the caregiver and say, how's it going? And I'll also let them know how's it going on our end. Well, we've noticed these issues. We're not having any concerns. Yeah, this is great. They're participating. No, we found that this seems to distract them a little bit more. And then we can either offer an additional day or we can offer an additional hour based on kind of what the caregiver needs and desires for their personal schedule. So we'll do that. And just kind of continue to evaluate and build upon those hours, as the caregiver needs for their personal schedule. We do serve a lunch here at Alz Place, so that's included in it, and that's the meal that comes provided from Meals on Wheels program, so that hot lunch is included inside of that, and so it meets a third of the dietary requirements. We actually had Elder Options, Elder Affairs here today for our annual survey, just to make sure everything's good and that we're providing menus that are signed off by a dietitian and giving the things that that we should be. So we have a licensed nurse that's here, which is me during the day. We also have CNAs that are here. We're a 1-to-5 ratio, so 1 staff for each client that we have, and we're able to assist with toileting needs for those clients who have some incontinence, or maybe they need supervision or reminders to be able to do that. So we have our CNAs that are here. We also are very, very thankful for the UF volunteers that come to the program. The majority of them are a pre-med track, but we have some engineering, some chemistry, but we have them here every day and they help us with our activities. Some of them help with serving meals, and they're getting that hands-on experience. It's so beneficial for those that want to become physicians, so they get that hands-on experience, because a lot of them, besides their grandparents, have never dealt with the geriatric population before. Last little bit, some of our day-to-day that we do is we have a routine. Routine for dementia is very important. Consistency and having that routine. I know what I'm going to do. I kind of know what to expect. I also am a certified dementia practitioner, and I received that when I was at the Windsor. And so that's been very beneficial to me as well. Also had a lot of training with Carolyn Lukert, who's very popular as well. But we have our routine. So we've got our morning social. We have our daily chronicle, which is something we do every day, which is like a history lesson of what happened when. We're going a little bit more digital here. So we put it up on the big screen on the TV. So the clients, even if they have visual issues, they're able to see a big, 65-inch screen TV. we've got a variety of activities from bingo that we do, arts and crafts. We love a theme around here. So whether it's Easter, we celebrated National Dandelion Day yesterday. So we did a dandelion art craft that we used with Q-tips and white paint. And then we watched a video on like the dandelions when you blow them and how they multiply. And we did a dandelion dance. I think I said bingo already. We do cornhole. We have ring toss, lots of different arts, but we have something on each level that our clients are able to participate. Some that are a little bit farther along on their journey may need someone to assist them with finishing the craft, but then we have someone who's earlier diagnosed and they're able to do everything and don't need any assistance. So we're just here to guide and help the families and have a win-win at the end of the day, that the client can go home tired and sleep well, and that the caregiver gets the respite that they need.
Wow, that's great. That was very descriptive of a very important program. How many slots do you have there?
So with this building size that we're in, we're licensed for 35 clients. We average right now 19 or 20 per day is what our average is. And that just varies based on, what client and caregivers need.
Great. Yeah, and I'm going to put a plug in for the Florida End-of-Life Doula Alliance and for the Gainesville group, that if there's any way we can interact or be a resource or come and speak or
Absolutely.
anything, let this be the beginning of a real network,
Absolutely.
stronger network. I also just do various things, and there are others of us here.
I'll just give a shout out to Tim who's on, because
yeah.
Tim and I, we work together. So sometimes, there does come a time where clients are not appropriate for our program anymore. If they are a two-person assist, or if they're becoming an issue where they're, near being bedbound, or they need a special diet that we can't meet here if it was pureed and swallowing issues. And so there are times, or they just need different services. And so I partner with Tim and the other case managers at Eldercare, so that if there are other services that they need, maybe they come here 2 days a week, but they don't have anyone, they might need Meals on Wheels, or they might need some low vision. There's other support at Eldercare, that those programs. So we coordinate back and forth with each other to say, hey, I have this client, or I'm not sure, they may be getting to the end of their journey here, but are there other things that we're able to offer them? And that's where Tim and the rest of the case managers come in hand to kind of duplicate as close as we can with funds that are available to have those services in the home that they were receiving here.
Yeah, like my mom she had a hospitalization. She had some issues with her body. And after that, she just, we tried bringing her, and then she was like falling down, and it was just time. And I believe it was probably 2 months before she actually died, just a couple of months later. So you guys hung in there as long as you could.
Yeah.
But I know it's kind of heartbreaking to have to tell people we have to let you go. But that's life, and that happens. And then what I ended up doing is I just couldn't do the whole at-home thing at the time. So I did find an assisted living that she could go to for a short time. But then she had a stroke and she was completely bedbound. And then I brought her home. And she had hospice and she died. But it was all so important to have that support. Well, this is great because we do have time for Timothy.
And I'll let Tim talk about, I forgot to mention it, so Tim can talk about our caregiver support group.
Great.
He actually, he runs that.
Wonderful. Thanks. Yeah. Go ahead, Timothy.
So thanks, Saja. I think you gave a really thorough overview of Alz Place. As you said, we do really try to provide a continuity of care. So if someone does go to Alz Place for a while and then they end up transitioning into home-based services, we can often do things like in-home respite care, or specifically help with bathing or cleaning. We do things like Meals on Wheels, as well as help with incontinence supplies. I think those are going to be the main core services in terms of what's going to be relevant to individuals diagnosed with dementia and their caregivers. I do facilitate a dementia caregiver support group the third Thursday of every month from 9:30 to 11, but there are several other support groups in the area too. If you'd like, I'd be happy to email you the list that I have right now, Ashanti, to share with the other group members. But we leave it as a pretty open format group. I've offered structure before, but really it's just an opportunity for caregivers to come in and connect together. They can learn from each other. They can just share whatever issues they're going through that week or whatever kind of loss they're going through or need to work through. It's really awesome that people have that to look forward to. Other services in general that might be relevant still, Aja had mentioned independence of low vision. Eldercare does offer help with low vision training and devices. So if you do have someone who is probably on the earlier end of the diagnosis, higher functioning, that can learn these new skills, it could help them still maintain their independence in the home. I've got other things I can talk about, but they are more just senior related versus dementia specific.
That's okay. I think we all would like to know a little more of what you
Okay.
have. Yeah.
Sure. So I can share the flyer with you as well. So beyond, so again, there's bathing, homemaking, respite care can do both of those. The main thing with respite is they can do the things that the caregiver needs when they're not there. That's non-skilled. They can't do medications, but they can bathe your loved one. They can take them to the bathroom, take them for walks. Some providers will let them drive them and take them places. We have case management, which would be someone like myself or the other case managers to keep you on the programs. Similarly to the copay for Alz Place, we work with the same program. So you would be, most programs are going to have a copay where the maximum is 3% of that person's monthly income. Compared to an hourly rate, what you would pay for a private agency, it's really affordable typically. We also do emergency alert response buttons. We have congregate meal sites throughout the county right now. We have one in Newberry, High Springs, Gainesville at the Senior Center, and Waldo. So most of them are 5 days a week around lunchtime. It gives people an opportunity to come and eat together and have a free lunch to eat together. So it supports their socialization as well as their nutrition. We do 2 round-trip rides a month with MV Transportation at no cost. We have a subsidized Uber program. So it's reduced rate Uber rides for seniors that have a smartphone that are traveling within Gainesville city limits and they reside within Gainesville city limits. We have help with past due utility bills. So you do have to be within a certain income range. We can help people keep their lights on, keep their heating and cooling. As you know, we are affiliated with the Senior Center. We manage all the programs here. We've got activities going on 5 days a week from 8 a.m. to 5 p.m. There's always something to do. I encourage you to look at our website. I'm sure you will find something that interests you. We also have a food pantry. We are probably one of the only folks who will occasionally deliver to homebound individuals. Most other food pantries probably wouldn't do that. And as I say, I think that's everything. There's usually something that I always think of after because it seems like we're always adding in new services. Grocery shopping. We are helping with grocery shopping. It's something that we started during COVID and found that there was still a lot of people that needed help. So whether it's prescription pickup, whether you want to use like Walmart shopping and have us pick it up, deliver to you, or if you just want to see maybe that's too techy for you, to go online and order, you can call Eldercare, give us a grocery list. We can get items for you and bring them to you and you reimburse us. So.
Wow, that's great.
Yeah.
So I have a question. If somebody has gone through your application process, either through Eldercare or at Alz Place, and they wanted to get the services at the other place or other services, do they have to go through the application again, or is your basic information there? How does that work?
Sure. So it depends. If you go to Alz Place first and you get onto the Alzheimer's Disease Initiative program and you end up aging out of that program and needing in-home services, there's 2 different pools of money, so of funding. So typically we have some funding that we can do in-home services, and then it's just a straight transition. But there is a wait list for in-home services typically. The main thing is once you're on the ADI program, you're on the ADI program, so you're eligible for other services. The good thing is that if you were to go through that process, the screening process that Aja mentioned with Elder Options, you would be able to get onto all of our other state and federal wait lists through that screening form as well. So it's kind of two birds, one stone mentality. If you call them to get into Alz Place, you can also be calling them at the same time to get on to all the wait lists for the in-home services.
Great. This is awesome. Well, gee, any other comments? Anyone who hasn't spoken? I see a couple of people here who haven't spoken. We'd love to hear from you. Okay, it's just been very informative, and I just love having this compact energy all in one little hour. So I
do
want
want
to.
to offer one more thing. So, one of our nurses that was here, who's now transitioned over to elder care, she was working on her bachelor's degree a few months ago for nursing, and her project was to kind of create a website of cumulative information for people. It's not all necessarily related to Alzheimer's or dementia, but she did make a website which is called AlachuaElderGuide.com. And it is kind of an all-in-one place that if you're looking for assisted living facilities in town, for skilled nursing facilities in town, companion services in town, it gives a list of let's see, I just pulled it up. So inpatient rehab, it has the adult day facilities, so us and Altrusa House. It's got home health care. It's got the local hospices that are in town. So it is a resource, and it kind of gives you a little snippet of what each category is, and then gives you some resources that you actually have, like phone numbers and contacts. And I believe there are some direct links that are on that. And then we do have information about some of the senior support groups that are caregiver support groups that are in town that are on there as well. So that's a nice little resource that was created by our nurse Addie, and it's alachuaeldercare.com. So if
Great. Yeah.
if they have questions, say, I don't know the skilled nursing's in town. It's got them all listed, and then you can just do your research and see who you like.
Well, I mean, that's great for, because, us doulas, we do a lot of different things.
Yeah.
We help people with writing their legacy or recording messages to their kids or having their advanced directives updated. And then advanced care planning is another step beyond just having the paperwork, but it's like really more in detail of what you want and help communicate with the family members and your surrogate, your healthcare surrogate or others about what you want and advocate for the patient where there might be confusion or misunderstanding among people. So it's just, it's lovely to have so much wealth of information and ability to help. And I've been, in January, I did a ceremony, or I officiated at a burial at the Prairie Creek Conservation Cemetery here in Gainesville, because they referred someone to me, and I gave her my specialty is grief, so I gave her some grief support, and then she was like, "Oh, can you come and do my service?" And I was like, "I would love to." So we are just very happy to be opening the conversations about death and dying and aging and or living until you die, or however you want to say it. And I don't know, Chris, if you want to add anything to that, because Chris is also on our board, and he's down in, I guess, in the Tampa area. Do you just want to say a word or two, Chris?
Yeah, no, I'm in the Tampa area. I love that the Alachua, you probably pronounce that right. Blame me for being
Alachua.
in Tampa. Alachua. Okay. I saw the elder guide. That's fantastic. A lot of death doulas around. We're doing our own work and research, so knowing that there is a an elder guide for the area is important. So we can save our volunteer time for not that.
There you go.
I appreciated hearing each about your facilities. And I need to get out to them, but maybe I just come up to you, Shanti, and I do some visitation up there. But I was curious as each of you were talking and how long you've been in the elderly industry, on what do you see as the biggest struggle for either the family or the residents that you have? Is there anything that pops up when I ask that question?
Yes.
From, yes, I was going to say that the first thing I see is a lot of denial. Um, denial is hard, especially for the married couples. Um, it's that this is the person that I married, which does not present as the person that I'm living with now, and how to separate now caring for this person is the biggest challenge. There's so much love that's there in a marriage when you've been with someone for so long and now having to be their primary caregiver and doing things that even though you said those vows, you didn't know it would be to this extent to where they may not even remember you. So denial is really hard, but also I think education is or lack of education for caregivers because they don't have the support. You know, dementia is still looked at something as kind of like taboo, and people don't want to discuss it. They don't want to talk about it. There's a lot of embarrassment about it to say that my mom has Alzheimer's, as people talk about cancer and you're a cancer survivor, and that's like such a big deal to be a cancer survivor, but someone who's living with Alzheimer's or dementia, there's like this stigma. And so oftentimes people don't want to talk about it. And then because then they don't seek out information, knowing that their loved one is in that situation. And then it makes it hard to care for them. So that's what I've seen being on both sides here, at the non-facility side, but at the facility side, lots of denial. Oh, I talk to my mom all the time. I talk to her every day, and she tells me that she went to the dining room. Your mom hasn't come out of her room in 2 days. It's that sort of thing. So, and I'm sure
Yeah,
that,
my granddad died of Alzheimer's. My dad has pre-onset dementia, so he's starting to slip. So this whole thing is personal to me. But I'm here to help. It's interesting hearing about that because I just had that conversation twice over the last couple of weeks about couples, and you're like, this is not the person I married. What do
yeah,
you do with that? You
yeah.
feel like you're sticking a knife in your own heart as you're turning them over to a facility,
Hmm.
um,
Mhm. Mhm.
torturing yourself as the
Yeah.
caregiver. Don't, so
That's hard for a lot
education,
of
it sounded
people.
like.
Yes, that's hard for a lot of people. And I have those conversations with our caregivers here sometimes because they talk about placement and they feel so bad. And I have to explain. And my thing is, everyone's relationship is different with whoever they're caring for. It may have been a mother or a father who was kind of absent from their life, and there might not be that close-knit one, that relationship that was there. But even if it was, I feel like the caregiver needs to make the best decision that's best for the caregiver at that time. And sometimes that is placement. If when you're in a facility, there are people, number one, who are going to be there 24/7, who's someone's always going to be awake. That person may get to a point where they're bedbound and they need a lift to be able to get in and out of bed. And that's cumbersome. People may not have the space in their home to be able to do that. And so I think looking at it in a more positive light of saying, it's okay. It's just like I'm asking for help and acknowledging that it's okay if I get help, if I have to go to a facility. It doesn't mean that I don't love my husband or that I don't love my mom. There's just certain things that I'm not able to do to care for them in the home. And going to a facility is okay. And I think educating caregivers and families that if you have to make that decision, that it's okay and don't not to feel bad.
Yeah, and then the other thing about that is the work that Timothy and I and others do around grief support, because when you can really talk what's really on your heart and unload that and have someone just look you in the eye and just listen and acknowledge you and validate you, then it can arise out of your own awareness or understanding, or sometimes it's good to have someone say, well, you could consider, a lot of people do this. It's, whether you want to advise or just listen. But the the reason I went into grief work is that when mom died in 2018, I looked and looked for then we had COVID, so I looked for online support and grief support, and maybe one hospice would have someone would see you once a month or 3 times, or it just was never, it wasn't enough. And so then we went through COVID, and I did find some, but it was frustrating because I'd rather not go to a support group where there's just a lot of chit chat, and then feel heartbroken that I went to something that wasn't helpful to me, and then go back into my bed. I would have rather just stayed in bed and listened to some music, So it's really, yeah. So, who else? Johnny, did you have something you were going to say a while back?
I did, but I realized we're running short on time. I was going to
That's
respond to
okay.
Chris's question regarding the challenges in mine. Well, first of all, to respond to Aja's very accurate point about caregivers needing education, is literally why we're here, and it's why we offer the types of things we do, which are evidence-based. So the science proves, and even again, Shanti is one of those people who can sort of give us that actual user feedback to say, been through it, it made a difference. The number one thing I hear from people is, I wish I had done this sooner. So the education piece, I think, comes way, way too late in the process, and they've made a lot of what they term as mistakes, and we just understand as life. But the other thing I would say from a more practical standpoint that I see that caregivers are desperately in need of are learning how to navigate the legal system and all the legalities of dealing with a person who might have diminished capacity. And number two is respite, which is a major struggle for so many people. And even to attend any of the things we're talking about, even a support group, even the virtual support groups, we've had people who tried to attend a virtual support group, but got interrupted the entire time by the person they were caring for. So respite is huge. So just a couple of points from what we see practically.
Respite's essential because it'll end up costing you whatever the price is for your insanity.
Yes.
Yes, absolutely.
I have your
I'd like to
flyer for
add
your
something.
next session at our front desk, Johnny. So
Awesome. Thank
yes,
you.
we have it posted.
Thank you.
I have to drop, Johnny. I'm gonna
Okay.
watch the recording because I missed your 10 minutes,
Yeah.
but thank you all
Please
so
do.
much.
Yeah,
All right.
we'll get it out there soon. Yes,
Cool.
and then Meg thanks, Chris. See you soon. Yeah, he's on our board. He's great. Meg.
Aja and Johnny had some really important things to say about education. And, at the Windsor, we want to meet the families where they're at with whatever they're going through, but the education helps them understand the timeline, because so many times we are dealing with families that are now in a crisis, and that means they are depending on the availability that might not be there. So education, one of the things when they're walking out the door, if they're not deciding on the Windsor, that's fine. But I try to give them resources. I do give them resources to check into so they better understand the timeline, because people think they have a year or two to deal with it. And then, a lot of times we get a call a couple months later, Aja, I know you know all about this, and they're ready because there's been a crisis and the loved one's in the hospital. So the education and the resources, that's what saves these families from
Right,
going.
and
We try to do outreach to help curb that, that timeline that ends too quickly for most people,
yeah, and that goes with the willingness to talk about stuff and break the stigma,
Yes.
because
Yes.
it's just this fear, like there's just fear and fear of the
Yes.
unknown and helplessness and powerlessness and all of that. And so we also have a program that we offer monthly at the library. I don't know if you've heard about it, but it's Conversations About Death and Dying, point blank. And we were doing it before COVID, and we picked it up recently. And it's just that hour of open-ended conversation. It's kind of like a death cafe without the tea and cake. And we have people coming in all kinds of different situations. We had a couple of friends who both know they were having an onset of dementia, and they wanted to get connected and think about stuff before. We have people who are interested in medical aid in dying, which we don't have in Florida, but we can inform them about things. One thing people do to hasten death would be just not eat and drink. And you know, one thing I regretted, I didn't really regret it too much, but like always wanting mom to eat. Eat. You know, she was maybe 90, 95 pounds, but because it's our motherly instinct, we all want our people to eat. But in the dying process, when that begins, and you don't know when it's beginning, they don't want to eat, and you don't want to force food. And we used to remember, as we used to talk about the red plate. If you use a red plate or put chocolate on your spaghetti or whatever, that'll make them eat. But you know what? Give it up. Let them do whatever they need to do. And I also remember I had mom. I was like, put in your teeth, put in your teeth. And there came the day that we were fighting about it. And that was the last time she ever put her teeth in. Like I had to let go of her having her teeth in. So we could go on and on. This has been amazing. I think the conversation after the presentations is really pretty hot. So good to get to know all of you. And please let's stay in touch. And if you want, I'll put you on my email list of events and things, and please do the same with me, and we'll see where this goes next. I just appreciate you so much. All right, we're going to sign off then.
Thank you.
Thank you,
Shanti.
everyone.
Thank you. Let's unmute ourselves and go.
Thank
Bye.
you.
Bye. Thank you.
Bye.
Lovely.
Thanks, everyone.
Have a great
All right,
day.
we'll see you next time.
Bye-bye.
Bye-bye.